Thank you for joining us at AskTheseDoctors.com. This video will provide flu facts in an easy-to-understand format and could potentially save you money at your next healthcare visit.
Thanks for joining us today. How can I help you, Mrs. Smith?
Doctor, how do I know if I might have the flu?
Well, first off, the flu is a virus. It's actually influenza, and there's two types, type A and B. Some people confuse having vomiting and diarrhea with having the flu. That certainly may be a symptom of the flu, but if those are the only symptoms you have, it's probably not influenza. The symptoms include a sudden onset of fever and chills, cough, sore throat, runny or stuffy nose, fatigue, severe body aches or muscle aches, and as mentioned before, some people may have vomiting and diarrhea. That's more common in smaller children.
So now what do I need to do?
Well, first off, the flu is spread by droplets. You need to cover your cough and put your Kleenexes in the trash immediately. Some patients may get the flu from touching a surface where somebody else coughed or sneezed on. You need to know that you're contagious one day before symptoms start and for 5 to 7 days after you first become ill. There are some guidelines regarding who needs to be seen and treated. The CDC, which is the government agency that provides guidance and recommendations for healthcare providers, gives us a whole list of things that we need to know about. For example, pregnant patients or those with underlying chronic health problems, asthma, chronic lung disease, diabetes, immune problems, among others, are at more risk for flu-related problems. Particularly young children less than the age of 2 or older patients older than the age of 65 have more likelihood of having complications from the flu.
What can I take over the counter?
That's a good question. Oftentimes the fever and body aches from the flu can be treated with Tylenol or ibuprofen if you don't have any problems with those medications. You want to ask the pharmacist for their recommendation. The other option is to contact your doctor, doctor's office, the nurse line, or the helpline. Many clinics or insurance companies have a 1-800 helpline that can give you some key information regarding the flu. Not everybody needs to come into the clinic. Mrs. Smith, you're 35, you're healthy, you exercise, you don't have any underlying medical problems. You'll probably get over the flu just by treating the symptoms and taking care of yourself.
Don't I need to be tested?
That's a great question. The flu can be diagnosed clinically. As you saw from the previous slide, there is a list of symptoms that most patients have. The swabs we use are not perfect, nor are they fun. The swabs go either in the nose or the back of the throat. There's a cost to the swab. The cost can be anywhere from $25 up to $80 or more, depending on what swab your clinic uses. And they're not perfect. For example, most of the swabs, the sensitivity is 70%. What that means is 30% of people that get swabbed and come up with a negative result still have the flu.
Can you give me a prescription? And how much would it cost?
There are prescriptions to treat the flu. They're antiviral medications. What you could expect from taking these medications is you may feel better 1 or 2 days faster. If you're otherwise healthy, you probably don't need these medications. As you can see from the list, the top 2 are fairly pricey. You need to start these medications within 48 hours of the onset of symptoms, otherwise there will be very minimum benefit. There are some groups of patients that may benefit from taking these medications, particularly those in the previous slide, pregnancy, chronic medical problems. Be sure to talk this over with your doctor and get their opinion on whether you need these medications or not. There are some guidelines that the CDC has regarding who should be treated. There are some benefits for treating after exposure. That's called prophylaxis. For example, a diabetic patient who has a small child at home with the flu might benefit. A pregnant patient who's been exposed to the flu also may benefit. Keep in mind there is an office charge and a visit charge and also the lab charge, which can add up quickly. Be sure to talk to your doctor's office about some other options, such as being treated over the phone if you fall into one of these groups.
Are there any recommendations that doctors follow when dealing with the flu?
Sure. We follow the CDC guidelines, and you can follow that on the website. There are certain groups that we generally treat with the prophylactic medication to prevent it from occurring after exposure to the flu, or groups of patients who have underlying medical problems. They're more likely to have complications, and we generally treat those.
When should I worry about having the flu?
Well, if you're feeling short of breath, you're worried about dehydration, or if your fever returns. If you've had a fever for a few days, the fever goes away, and then returns, then your doctor is more worried about a secondary infection, such as pneumonia. If the flu isn't running its course in a typical time frame, then you need to be seen. If you're just not getting better after 4 or 5 days of treating your symptoms, you need to contact your doctor or be seen in a clinic. Or if you have the underlying medical problems we talked about in the previous slides, or you're at the extremes of age, either very young or very old, you need to be in touch with your healthcare provider.
What can I do to protect myself and my family?
Well, vaccination is key. There's two forms, the injection form and the nasal form. Be sure to discuss any concerns you have with your doctor regarding these vaccinations. There are recommendations that the CDC puts out, and your doctor will have those on hand. If you've had a problem with chicken eggs or severe allergy or severe reaction to the flu vaccine, or if you're a child 6 months of age and left, you don't qualify for the current flu vaccine we use. If you're sick at the time, you want to make sure that your symptoms lessen before you get the flu vaccine.
Can you recommend some online sources that are reliable?
The CDC, the Center for Disease Control website, is a very reliable source. They can give you some key facts regarding the flu and the current strains of flu and where we're seeing it around the country. They have a very helpful parent's guide to the flu, among other resources. They have several 1 to 2 page patient information pamphlets which are easy to read and give you all the data that you need to know. As you can see from this short video presentation, we've covered the symptoms of the flu, we've discussed whether an office visit is necessary, testing or not, treatment, vaccination. Remember, hand washing is key to prevent the spread of influenza. Thank you for joining us at AskTheseDoctors.com. Be sure to check out our other video topics for even more ways to save your healthcare dollar. Thank you.